Hello, everyone. My name is Becky Prevey, and I'm the Executive Director of the Association on Aging in New York. Each year, we are thrilled to be able to highlight an innovator in the state of New York who has worked with a volunteer program that has changed older New Yorkers' lives. This year, the Association on Aging in New York is thrilled to present the 2022 Innovative Volunteer Program Award to Holly Rhodes-Teague in the Suffolk County Office for the Aging. We are so proud to recognize Holly and Suffolk County's trailblazing work as partners with Sage Long Island and the LGBTQ Network to meet the unique social and support needs of older adults who are in the LGBTQ plus population, an effort that relies heavily on the goodwill, time, and talents of volunteers making a difference. Nearly 4% of adults aged 55 to 64 and just over 2% of adults over the age of 65 openly identify as LGBTQ plus. These adults are twice as likely as non-LGBTQ adults to live alone. Many face social isolation. Many are less likely than non-LGBTQ plus older adults to access services for the aging, including senior centers, meal programs, and other assistance programs. Through her work with the LGBTQ plus network, over the last decade, Holly Rhodes-Teague and her team at Suffolk County Office for the Aging have brought together their expertise serving older adults with a commitment to LGBTQ plus social equality and inclusion that have blossomed into a powerful collaboration with one of Long Island's leading LGBTQ plus social service organizations. This partnership is enhancing safe spaces for LGBTQ plus older adults seeking social activities. It's also bringing critical health supports, public education, and legal assistance to LGBTQ plus older adults who may otherwise lack access to specialized services that meet their needs. On behalf of Aging New York, our board, and our colleagues and friends in the aging services community, please join me in recognizing Holly Rhodes-Teague and Suffolk County Office for the Aging for this incredibly innovative partnership to help LGBTQ plus older adults. Thank you so much.
So I'm Holly Rhodes-Teague. I'm the director of the Suffolk County Office for the Aging, and I've been here 25 years in this position. Our connection to the new site is to try to connect the LGBT network to some of the other organizations that are out there in the communities. You know, some of them have programs that they don't normally run here themselves, so they would try to put it in. I'm trying to put in a nutrition program potentially, the chronic disease self-management programs. As the residents find things they want, we'll try to connect them to services that are out there. If this LGBTQ friendly housing gives them the opportunity to stay near relatives if they have them here still, and stay near their friends that they've known for a long time. You know, they have their own apartments, they're comfortable, there's a lot of places to go, and they can, you know, they're still part of the network on Long Island and their friends and family. Well, David always likes to say we met on a buffet line, which I'm not gonna lie, that's true, that did happen that way. We met back 2004, I think it was, and we introduced ourselves while we were, you know, standing there, and I have a great interest in the LGBTQ community. He was working with LGBTQ youth. The Office for Aging, so we were like, you know, we need to figure out a way to partner together. And I think at the time you were going to start some focus groups to see what services might be needed for the older adult. So I had an advocate start going to his social events that they were doing for the older adult, and from there you created more programs.
Yeah, I mean, it really was an instant connection.
It was.
You know, immediately I felt the connection and the passion, you know, for serving LGBT elder adults, and that's so important because not everybody has that. It wasn't. It was more than a program. It was a connection, you know, and it just showed you don't have to be LGBT to have that connection either. You just have to care and have that compassion.